A degree of caution is appropriate, given the dangers of abusing or misusing spiritual formation in psychotherapy. P. Scott Richards and Alan Bergen devoted an entire chapter to ethical issues and guidelines in their well-known text on a spiritual strategy for counseling and psychotherapy, published by the American Psychological Association. Richards and Bergen discussed the following potentially difficult ethical questions and challenges: dual relationships, religious and professional, displacing or usurping religious authority, imposing religious values on clients, violating work-setting boundaries, and practicing outside the boundaries of professional competence. Two other significant concerns they raised regarding the use of spiritual interventions in psychotherapy are becoming enmeshed in superstition and trivializing the sacred or numinous. Other potential pitfalls or dangers of religious psychotherapy, which are also relevant to integrating spiritual formation into psychotherapy. The first is imposing the therapist's religious beliefs or values on the client, thus reducing the client's freedom to choose. Or two, failing to provide sufficient information regarding therapy to the client. A third pitfall would be violating the therapeutic contract by focusing mainly or only on religious goals rather than therapeutic goals, and thus obtaining third-party reimbursement inappropriately. However, sometimes it is difficult to clearly differentiate between spiritual and therapeutic goals because they do tend to overlap for religious clients. Fourth pitfall is lacking competence as a therapist in the area of the client's values, or conducting religious psychotherapy inappropriately. Fifth, arguing over doctrinal issues rather than clarifying them. A sixth pitfall is misusing or abusing spiritual resources like prayer and the scriptures, thus avoiding dealing with the painful issues in therapy. The seventh pitfall, blurring important boundaries or perimeters necessary for maintaining the therapeutic relationship. An eighth pitfall, assuming ecclesiastical authority and performing ecclesiastical functions inappropriately when referral to church leaders may be warranted. And last, applying only religious interventions to problems that may require medication or other medical or psychological treatment. The ethical issues just reviewed are not exhaustive, but they include the major potential pitfalls inherent in any religious or spiritual approach to psychotherapy, including the integration of spiritual formation. These ethical dangers can be minimized or avoided by following several ethical guidelines for the practice of religious psychotherapy that incorporates spiritual formation. A therapist-religious leader dual relationship should be avoided. If a therapist concludes after careful review that a dual relationship may be in the client's best interest, the therapist should consult with a supervisor or professional colleague to see if they agree before entering into such a relationship. If agreement is found, the therapist should clearly define and explain the limits and risks of the dual relationship to the client. Frequent consultation should be sought by the therapist, and the dual relationship should be terminated and an appropriate referral made if it is believed that the client is being harmed by it. Lastly, careful documentation should be kept. Given the danger of displacing or usurping religious authority, Richards and Bergen recommend ethical guidelines for collaborating with religious authorities. Therapists should determine clients' religious or denominational tradition, and whether they see their religious leaders as possible sources of support or help. If the client agrees, therapists should obtain their written consent to contact, consult, and cooperate with their religious leaders. Therapists should be clear, respectful, and courteous in communicating with the client's religious leaders and should thank them for their assistance. Prior to using spiritual interventions, including spiritual formation, the therapist should make explicit to the client that they have no ecclesiastical authority over the client, and they cannot act or speak officially for the client's religious leaders or institution. Therapists should not perform ecclesiastical functions limited to their client's religious leaders, such things as hearing confessions, absolving, or pardoning sin. Therapists should explain where their therapeutic role overlaps with that of the client's pastor. Therapists should make sure that the client feels it is appropriate for them to use a particular spiritual intervention, such as religious imagery and prayer, before using it. Therapists should not put down or ridicule their clients' religious leaders and should let clients know if they generally see religious leaders and communities as potential sources of support and assistance. To avoid the danger of therapists imposing their religious values on clients, Richards and Bergen give guidelines for respecting client values. Therapists should respect their client's right to have religious convictions that are different from their own. Therapists should not arrogantly condemn their clients' behaviors or choices that run counter to their own convictions or beliefs, but they can engage in open exploration and discussion of the spiritual and moral aspects and consequences of a client's value choices and behaviors if the client wants to. When value conflicts occur between therapist and client, the therapist can express his or her own views while preserving the client's right to have different views. Therapists should consider whether their disagreement in values could negatively affect therapy and whether referral to another therapist may be warranted. They should include spiritual and religious goals and interventions only when properly informed consent is obtained from the client, who has clearly expressed interest in pursuing such goals and participating in such interventions. Therapists in civic settings must follow policies and laws regarding the separation of church and state in such settings. Therapists in civic and other settings should not employ spiritual interventions to impose a specific religious tradition on clients, but should always work within a client's value system. Therapists in civic settings should get written consent from both client and supervisor prior to using spiritual or religious interventions. And when conducting therapy with children and adolescents, they should obtain written parental permission. To address the danger of practicing outside the boundaries of competence, Richards and Bergen make the following recommendations for education and training standards for psychotherapists. Therapists should be trained in foundational multicultural counseling attitudes and skills. Therapists should read relevant and helpful scholarly articles and books on spiritual issues in counseling and psychotherapy, as well as on the psychology and sociology of religion. Therapists should attend at least one workshop or course on religion and mental health and spiritual issues in psychotherapy. Additionally, they should take a class or read one or two good books on world religions. Therapists should obtain specific knowledge of religions and spiritual traditions that they often encounter in therapy. Therapists should seek supervision or consultation when they first see a client from a particular religious tradition, especially with issues the therapist has not dealt with before, or when they first start using spiritual interventions, or new, untried ones in their therapeutic work. Using spiritual interventions only when led or prompted by the Holy Spirit. Prior to using such interventions, make sure there is first a relationship of trust with the client. Informed consent from the client should be obtained, and the client's religious beliefs should be assessed before any spiritual interventions are initiated. Work within the client's level of spirituality and value system. Integrating spiritual formation into psychotherapy is a valid and exciting undertaking. Integrating spiritual formation into psychotherapy from a biblical perspective requires dependence upon the Holy Spirit and a prayer-filled life yielded to the Lordship of Christ, including regular practice of the spiritual disciplines. The potential is great for deep blessing and greater wholeness and peace for the client who freely chooses therapy that aims for psychological and spiritual growth as well as the reduction of psychological distress.